You're sitting there, peacefully feeding your baby, when suddenly, milk comes shooting right out of their nose.
Your heart absolutely races, right? You instantly freeze and think, oh my gosh, did my baby just choke? Is milk in their lungs? Is this dangerous?
Well, let me give you the ultimate relief right here, right now. In many healthy babies, this is usually not dangerous at all.
But here's what surprises most parents. Why exactly does this even happen in the first place? I mean, it looks absolutely terrifying. So understanding the why is really your best defense against that sudden panic.
A lot of first-time parents actually don't realize that a baby's nose and throat are directly connected. It's like one continuous little plumbing system. So when your baby spits up, that milk sometimes just travels straight upward, right into the back of the nose before finally coming out of the nostrils.
Okay, let's dive into this just a bit deeper. According to the American Academy of Pediatrics, spit up is incredibly common in those first few months of life. And why is that? Well, your baby has a very, very small stomach, a totally immature digestive system, and those tiny little muscles between the stomach and the esophagus, they're still developing. They're basically just learning how to keep liquids down where they belong.
Think about normal feeding versus what triggers a spit up. Normally, the milk just sits comfortably in that tiny stomach, but add in some everyday spit-up triggers like sudden movement, burping, or just lying them totally flat, and that allows a backward flow. The milk just easily exits right back out the mouth or the nose.
Now, this is the part many people don't know, and honestly, it's the question I hear the most. Is my baby actually choking when this happens?
Fortunately, spit up through the nose is not the same thing as true choking. Healthy babies actually have these amazing built-in protective reflexes, specifically coughing and sneezing. So if your baby gives a brief little cough or sneeze after spitting up, they are just naturally clearing their own airway. If they quickly settle down, breathe comfortably, and act like their usual selves again, you're in the clear. It's not dangerous.
So the crucial point is what you should actually do in that exact terrifying moment. We've got a really simple checklist to help you get your control back. First, just stay calm. Second, hold your baby upright. Third, just allow them to cough or sneeze naturally to clear it out themselves. And finally, just gently wipe the milk away from the outside of their nose.
But here is one major thing to remember. Please avoid putting your fingers deep inside your baby's mouth or nose to try and fish anything out. You really want to keep that airway totally clear of any obstructions. If it's really needed, your pediatrician might recommend using a simple saline spray or maybe a gentle aspirator just to clear out the visible milk instead.
Quick question for everyone watching this explainer today. Has this ever happened to your baby? Let us know in the comments. Honestly, sharing your own scary moments and how you calmly handled them can be incredibly reassuring for another new parent who's sitting there watching right now. But here's the important difference. While most spit up is totally harmless, when is it actually time to pick up the phone and call the doctor?
You really need to seek prompt medical advice if your baby shows any true red flags. We're talking about difficulty breathing, blue or gray lips or skin, persistent choking, or repeated forceful vomiting. Also, keep an eye out for poor weight gain, a total refusal to feed, a fever in a young infant, or if these episodes are just happening with increasing frequency. Healthcare professionals will look at that whole clinical picture to make absolute sure your baby is safe.
Knowing all this can really save you a lot of unnecessary worry. Look, seeing milk come out of your baby's nose is always going to startle you. But the wonderful news here is that it gets so much better as their little digestive system matures. Knowing what's just a normal part of development helps you respond to these scary moments with calm confidence rather than sheer panic.
If you found this explainer helpful, make sure to subscribe to the Parenting Manual for more guidance backed by trusted sources like the NHS, MedlinePlus, and the Mayo Clinic. But before you go, I want you to ask yourself, what other quote-unquote scary newborn behaviors are actually just hidden signs of a perfectly healthy developing baby? Well, we'll uncover exactly that in our next explainer.